Imagine waking up every day feeling anxious, depressed, overwhelmed, knowing you need help, but being told that the next available appointment is months away. For many Americans, that isn't just their story, it's their reality. As someone who has worked in the healthcare field for many years and now pursuing my nursing degree, I've seen how mental illness not only affects the patients, but the patients' families. I feel that mental illness deserves the same attention as physical health. Today, I want to persuade you that the Florida state legislature and Congress should increase funding for community mental health programs and expand access to licensed providers and continue supporting mental telehealth services so that people can receive care when they need it. According to the National Institute of Mental Health, 1 in 5 adults in the United States experience a mental illness each year. Yet, many people never receive treatment, and that's because they can't afford it. There aren't enough providers, or they face long waiting lists. The thing about it is that untreated mental illness doesn't just affect one person, it affects all of us. According to the National Alliance on Mental Illness, untreated mental illness costs the United States hundreds and billions of dollars each year through lost productivity, emergency health care, and disability. Investing in early treatment saves life and reduces these long-term costs. I've personally seen patients come into the emergency room during mental health crisis after struggling to find help earlier. Those experiences reminded me that getting help shouldn't depend on where someone lives or how much money they have. The solution is achievable. Florida lawmakers should invest more into the community mental health clinics, and the Congress should definitely continue expanding telehealth and improving insurance coverage for mental health. Some people argue that it would cost too much, but preventing a crisis is far less expensive than treating one after it happens, in my opinion. Now imagine a future where someone is struggling with depression, right? Can you see a therapist within a day instead of months? Imagine students receiving support before anxiety affects their education, and families getting help before problems become overwhelming. That future is possible, but only if we act. Today I ask that you contact your Florida state legislator, member of the Congress, and encourage them to support and increase funding for mental health services. You can also support organizations like the National Alliance on Mental Illness and encourage friends or family members to seek help when they need it. I'd like to leave you with this. Mental health is health. No one should have to suffer in silence because care is unavailable or unaffordable. Together, we can reduce stigma, improve access, and make mental health care available to everyone. Thank you for your time.